Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752. And did you know when you call the program today, you get a free book, Dr. Darrow's latest. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. And right now we are speaking with Rick in Seal Beach about his ankle, his wife's ankle.
Hey, Rick, I want to just give out a little information before I ask you some more questions. First of all, the work that I do is called regenerative medicine, which is regrowing parts of the body, ligaments, tendons, the cartilage, and the joints, and it works from head to toe. I've been doing it for since like 1998. That's quite some time. I graduated my residency at UCLA, and I started doing it there. And it was kind of funny back in the day. None of the other doctors liked what I was doing because I'd been experimenting on myself and had very good results. So then I had, I asked the patients if I could do that on them. But a lot of the other doctors were like, "What are you doing? We never heard of this before." Eventually, after I graduated there, I started teaching there, which I did for about 20 years. And I would inject right there all the patients at UCLA. And I trained a lot of the doctors there how to do this. And a lot of them are now out being my competitors, which is great. I think the more competition, the better it is. But from what I know, I do the most of this in the country. There may be other guys that do more. I don't know. I'm told I do the most. And I've had very amazing success on my body. And Nita, on your body, we've had great success.
Yes.
And thousands of patients. I get, maybe 60 to 80 new patients a month that I've had, for the most part, really good results with. Obviously, nothing works on everybody. But the thing I like about regenerative medicine using platelets and stem cells is that it's a very conservative type of procedure. It's not cutting open the body to try to fix things. So anyway, Rick, I do think there's hope for your wife if you want to drag her over. I know she's not on the phone. She's shy. You can call the office at 800-300-9300 and get more information from them. They're by the phones now. If the phones are busy, you can just leave your name and phone. They'll get back to you. And for calling in, I'm going to send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The foreword to the book is by the beautiful Suzanne Summers, who is one of the greatest advocates of what is called alternative medicine on the planet. I don't think it's alternative at all. I think surgery is alternative, but that's the way the society looks at it, and that's fine. More and more people are moving away from surgery to doing regenerative medicine. It just makes sense. Why are you going to cut open the body and cause all that damage? You know, a lot of surgeons, when they cut the body open, and then they fix whatever they fix, and then they suture it up. Before they suture it up, they'll put in some stem cells. Well, why not just do the stem cells without cutting the body open, just using a needle? That's called percutaneous, a lot simpler. So anyway, Rick, thank you so much for calling in. We're going to go to Susan, who also has a foot issue here. Susan, Dr. Marc Darrow, how are you today?
Good morning.
Good morning, good afternoon, good evening. What's going on with your foot?
So I've had plantar fasciitis for 4 years now and have not found anything to cure it.
Okay.
I'm interested to hear what you have to say.
Okay. I treat a lot of plantar fasciitis. I do it with ultrasound guidance of the needle so I can watch exactly where that needle is going, and they usually heal up very quickly. So that's the good news. The bad news is I make people wear a walking boot so that they're not stretching out that ligament that attaches to the heel bone, the calcaneus. So if you want to heal quickly, you wear a walking boot. It's one of those big black things that goes all the way up to your thigh. Actually, not to the thigh, but up the upper calf. And it's got the Velcro straps on it. And then so you don't waddle, I like people to buy what's called an Even Up. It's a platform that's the size of a shoe, like a big sole of a shoe, and you just strap it on your other foot. Okay? So that's the bad news. People don't like that, but it heals faster because as we toe off in our gait cycle, we stretch out that ligament that attaches to the bone where that initiation of pain is from. Now, a lot of people have bone spurs. Bone spurs are not painful, typically. They can be, but generally not. They're a result of the ligaments or tendons being stretched. Re-injury, 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 re-healing, re-healing, re-healing. So there's micro tearing, and then the body builds up tissue there in the form of calcium that looks like a spur, a bone spur. Do you know if you have a bone spur, Susan?
I had a MRI like 4 years ago. There were no bone spurs.
Okay, that's good. But again, bone spurs don't limit the healing. Okay? A lot of people say, I have a bone spur, I need to get surgery, get that taken out, and then I'll come see you. Well, you don't need to do that. The only time a bone spur is really important, I had one of these in all the years of my practice, was a gentleman that couldn't lift his arm up, and I got an x-ray, and there was a bone spur that was literally about 6 inches long that went down into his humerus from his shoulder. So that was a complete block. I said, you could consider getting surgery to remove that 6-inch spur. And he said, well, I don't want to do surgery. I'll work with you and we'll see if we can just get some more range of motion, which we were able to do. So do you have any more questions about plantar fasciitis, Susan?
Yeah, just how long do you wear the boot for?
Well, typically what I do is I'll inject, this will be up to you and we can talk about it when you come in. First of all, I have to find out if it really is plantar fasciitis, okay? A lot of diagnoses that walk in the door are wrong for any part of the body. They're just wrong. They usually will come from an image, and then the surgeon or primary doc will go, look at that, that's your problem, when it isn't. So I get that all the time. So I have to do an examination and find out really where the pain is being generated from. Once I find that, then we can decide if I can help you, and then if I can, which treatment we'd use, whether it be platelets alone or platelets with stem cells. Okay, that's a choice that you make. I don't force you to do anything. I don't tell people they should treat. They say, what should I do? I go, I don't do the shoulds with anybody. If I did that, you'd be shoulding on yourself. Nita, you're supposed to laugh. You're a psychologist.
I'm laughing.
No, I don't do the shoulds with people. It's always a choice. And I can give you what I would do for my body, but you have to decide for yourself if you think what I tell you is real and if you think it's appropriate for you. Just because I've been doing this for over 25 years or so doesn't mean you have to believe me, right? You got to figure it out.
Of course. So if it turns out that, yes, it's plantar fasciitis, yes, I want your treatment, and then I was curious to know how long the boot treatment and is it
what I typically do with people that are local is I'll inject when they come in the office, or if they don't want to do it, they can come back and do it. And then on that day, some people bring their walking boot with them, or they'll go to CVS or somewhere else, or they can get it on Amazon and have it delivered the next day. They'll wear that for about 2 weeks, and they'll come back and see me in 2 weeks. And then we'll take the boot off and see how they're doing. So we have stairs in my building. A lot of people come and go, I feel better, but I don't know if it's because I haven't been doing anything. And I'll say, take it off and go run around. Let's see how it's doing. Mm-hmm. And then we'll decide if they want to treat it again. Some parts of the body will need several treatments. I can't guarantee anything. I make people sign a consent form that says there's no guarantees. Medicine has no guarantees. The only guarantee I can give someone is if I cut their leg off, it's going to stay off. I'm being facetious, but you get what I'm saying?
Yeah, let's not do that. Okay, well,
No, I mean,
good. It sounds optimistic. So I have
it's very optimistic. Most of these heal up pretty quick.
Okay, terrific. Well, thank you so much. I appreciate it.
All right, and the number to the office, if anybody wants it, is 800-300-9300. I'll give it again. It's 800-300-9300. And you can get more information there directly. People are usually by the phones, or just leave your name and phone number. We'll get right back to you. And then for those of you that want to talk to me live right now, just call the studio. And the number here to the studio to talk to me is 866-870-5752. I love my callers. Please call and take the heat off Anita. It's 866-870-5752. Susan, God bless you. And we're going to go to John in Garden Grove, and he has a question about an injection, a type of stem cell. Go ahead. Hit me with it. This is Dr. Marc Darrow. John, what's going on?
I wanted to ask you about what is known as Wharton's jelly.
Okay.
The specific name would be Cortex or Protext, and I think it's an umbilical cord-based injectable. How does that stack up or compare with some of the other stem cell injections?
John, where did you get this information from?
From a doctor, from somebody who actually is preparing to see a doctor and receive these injections.
Okay, so I'm a little confused. It's not about you. It's about a doctor who's going to go see a doctor, and you're calling
No,
for...
it's about somebody, my aunt.
Oh, it's your aunt.
Yes, and now she hasn't gotten these yet, so she wanted to find out how these stack up.
I gotcha.
Some of the other types
Sure.
of stem cell injections.
Sure. This is way too complex an issue for this radio show, so what I'm going to do is I'm going to call you personally after the show, okay? I have your number there that you gave to the call screener. Is that okay if I call you personally?
Yes, by all means. Thank you very much.
It's a very complex issue. I need to know more, and I don't want to muck up the show with all that information. And if you wanted to, you could just email me also through the website at www.lastemcells.com, and we could start a dialogue there. But I'm going to call you. Hopefully you'll pick up, and we'll get to the bottom of this for your aunt. In my personal experience, it's not as much the type of stem cells that are used. It's the, in golf, they say it's not the arrows, it's the Indian. That means it's not the type of golf clubs you use. It's the person who is the pro doing it. And it's the same thing with MDs. If you're an MD and you do this all day long, there's a very good chance that you're going to be able to do a great job. Okay? Neat, are you with me?
I am right here.
Good. Yeah, I heard a little click and I didn't know
that
where
was
it was coming from.
that was our guy hanging up.
Okay.
That was John hanging up. Yeah.
Okay. So, John, I'm going to call you right back after the show in about 15 minutes. And in the meantime, I'm going to give out the phone number to other people to call in. The phone number here at the studio is 866-870-5752. And the number to get a hold of me or my staff at the office is 800-300-9300. And to watch me doing these procedures, there's videos on my website with tons of information, studies, and everything else at www.lastemcells.com. I'm going to give out a copy of my book for free if you call in right now. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The foreword to the book is by Suzanne Summers, the amazing actress. She's a great singer, too. What a great Irish voice she has.
Oh, I had no idea.
Oh, my God, she's amazing. Just a great actress. And one of the greatest proponents of natural medicine, which is what I do. You need surgery sometimes, but the times you need it is a lot less than the times that it's done. So I'm very careful to make sure, I send people to orthopedic surgeons for a second opinion, and then when they all come back with you need surgery. But if it's an emergency, I'll tell the patient to go do it. But that's pretty rare. So I'm going to go to another question, unless you have some. Yeah, I have one more thing to say before I do.
Okay.
We also use these same procedures of regenerative medicine on the face. It's called the vampire facelift to regrow the collagen. And that's a very simple procedure. We numb up the face and inject the same kind of cells, platelets or stem cells or both, into the face, and we can do it on the top of the head to thicken up the hair. So pretty amazing stuff. More and more research is being done on it. We do research on it in our office every day. I've got about 25 students that work with me doing research. They're all trying to either get into medical school, some to get into college. I have actually some high school students, and when they get their name on a paper, it helps them get into college or into medical school. Or if they are in medical school, it helps them get a good residency. I actually have some residents work with me too. So we have a lot of research going on, and I love it. I love my work. I love watching people heal naturally. I think that's just so amazing, rather than doing needless surgery that shouldn't be done. All right, so here's a question on father-in-law's knees. Let me see what the story is here. Hello. I'm sending this question to inquire how long of a wait it would be to come in for stem cell therapy for my father-in-law's knees. We're from Canada and trying to figure out treatment options. So unfortunately, there's very few, if any, practitioners that do stem cells in Canada. I know that because I get a lot of Canadians who fly down here to get treatments from me. A lot of the Canadians that I treat are what we call snowbirds. They hang out in Palm Springs for the winter, and they come and see me. So if someone is flying in or comes a long distance, I take priority for them. I'll get them right in. Even if it's the same day, I'll fit them in. So the answer to the question is, well, it wasn't even asked, but the answer is we treat knees all day long. We probably do more knees than anything else. After knees, maybe low backs, necks, shoulders, hips, toes, fingers. We just inject all over the body. And this stuff is amazing because it's really the same process wherever I inject. It stimulates new tissue to grow. It regenerates the tissue. It thickens up the cartilage and the collagen. And it rejuvenates the body. Is it going to work on every single person? Well, the tissue will grow on everybody. We know that because studies have been done. But whether a person feels better or not cannot be guaranteed. And the biggest failures that I have with this treatment is that people won't listen to me. They'll either be too active after a treatment and not give it a chance to heal. They'll be taking ibuprofen or other anti-inflammatory medicines that block the inflammation that is needed for healing. And people say, well, I already have inflammation. Why more? Because the level of inflammation you have is not enough to kick up the fibroblastic activity of cells that are drawn to the area from inflammation that actually regrow the tissue. Oftentimes the problem is people don't get enough treatment. They'll try it one time. They'll come back and say it didn't work. And I say, you signed something here in the consent that says it doesn't necessarily take one treatment, that it could be more. And you don't believe that, and you signed it. And they go, no, I really did know that, but I just had expectations, and my expectations weren't met. And then I think, another reason is a lot of doctors don't use ultrasound to look inside the body to guide the needle. That's a big problem. The studies show if a doctor injects a knee and doesn't use an ultrasound, 1/3 of the time the cells or the fluid is not even going into the joint. So it's a mistake. And then, of course, the biggest issue is using, I'm going to call him a bad doctor, someone who really isn't trained, who doesn't do this for a living, who has been hired for the day to come in and just do a bunch of these, and or a nurse. Nothing against nurses, I love them. But they'll bring in a nurse sometimes to do these shots, and it's someone who doesn't even know musculoskeletal anatomy. I had a patient two guys come up from Panama, and they had IV stem cells, and they had a nurse inject the knee, who obviously didn't know what she was doing. They spent $30,000, had no results. So nothing against Panama, but you got to have someone who's trained who does this all day long. Anytime I refer out a patient, for anything, cardiac, kidneys, you name it, I tell them to go with someone who does that work all day long, not someone who piddles in it. That's the same thing with regenerative medicine. So I think there's good hope for this person with their knee or their father-in-law's knees, and I'd have to see them to examine it just like everybody else. So...
Sounds good.
Yeah, it sounds great. I'm going to take another question after we give out the phone number one more time. We're getting to the end of the show, but I could take another caller if you call in now. 866-870-5752. So this one says, lots of lower back pain, some sciatica on left side. Let's see what the question is. Oh, that's the question. It's that simple. So the person has lots of low back pain that I can usually help heal. And then the sciatica, sometimes I can help and sometimes I cannot. If there really is a nerve impingement, sometimes that's difficult to help. Sometimes an epidural is a good way to get rid of it. Sometimes that person needs surgery, and I will refer out for those things if we can't get it better. Now, there is a chiropractor. I love chiropractors. They work on me too. A lot of times I can heal the low back pain, and then the leg pain will still remain. And I will send, my favorite chiropractor is Randy Webster. No, that's not. That's my old favorite chiropractor. Randy's not in business. It's Randy Weinzoff in Santa Monica. And then there's another one in the Valley that I love, whose name is Dan Monaco. He's amazing too. So if you're having leg pain or arm pain, if we find out that I can't help you, then I would refer you to one of these guys. If it's something really nasty, I might just refer you directly to a surgeon for a second opinion. But that certainly isn't my first choice, because there's too many of these neck and back surgeries that come out terrible and shouldn't have been done in the first place because no examination was been done. All they did was get an MRI. They didn't get an EMG or nerve conduction study to even find out if there was a pinched nerve. You can have arm pain or leg pain that's just a referral pattern from the neck or back. And a lot of those things we can help heal. They could be trigger points. And there's a book that I wrote on prolotherapy that has diagrams on those referral patterns. In acupuncture, they're called meridians. In Western medicine, they're called trigger points or referral patterns. So, Anita.
Yes.
What else we got? Here's a question on platelet-rich plasma therapy for lower back. Let's see about this one. I'm interested in additional literature regarding platelet-rich plasma therapy for lower back due to compromised lower back disc. So, this person was told they have a compromised lower back disc. I'm not sure exactly what that means. Oftentimes, a disc can be extruded, sitting on a nerve, causing leg pain. And we have lots of literature in my book, which I'm going to send out to you folks who call me in right now for free. The studies that show that PRP, platelet-rich plasma or stem cells, can actually help discs too. So don't jump to surgery if you can do something conservatively in medicine. Always use the conservative method in medicine. Don't jump to invasive things. Invasive things can hurt you. You know that. You have friends that have had surgeries that have made them worse. I'm a candidate for that. That happened to me in med school, and that gave me a very jaundiced eye. I was going to be an orthopedic surgeon. I love doing the surgeries. It's fun. But after that, I jumped ship. Nita, great host you are. Suzette, thank you. Alex, again, if you want to get a hold of me, the number to the office is 800-300-9300. You can watch videos of me doing procedures. www.lastemcells.com. God bless you all.
Thank you, Mark. And listen to our Pal War next time from 11 to 1 on the Pet Show every Saturday, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.